Keeping virus activity low will also ensure that our schools remain open. As we know, school is back in session. Sports and extracurricular activities have resumed, and this is a good thing for students in our communities. But as typical, at the start of any school year, virus activity increases when students return to the classroom. Evidence shows that the transmission rate for COVID and the risk of serious illness is lower among our children. Still, schools are taking their responsibility to mitigate the virus very seriously, while also maintaining some sense of normalcy for their students. Since schools reopened, I've heard from and I've spoke with superintendents across the state to get their perspective on what's working well and what could work better. And a common frustration that was expressed to me was around the guidelines for quarantining students and teachers who have been in contact with positive cases. So despite their commitment to implementing layered mitigation strategies to protect the health of their students and teachers and staff and to keep everyone in the classroom, in some situations they're having to quarantine a disproportionately high number of students when just a few positive cases have been identified. Iowa is definitely not alone in this challenge, and we have been assessing how other states have handled the situation. Nebraska and Wyoming have recently adjusted their quarantine guidelines for schools based on whether staff and students are wearing masks. Other states are considering similar changes, and following an assessment that I asked Dr. Pedati to do and her team, we're prepared to do the same. I've asked Dr. Pedati to talk more about what she's discussed with some of her colleagues, what she looked at, and her recommendations for adjusting quarantine guidelines. Dr. Pedati?
Thank you, Governor. You know, it has not quite been a year since this virus was first recognized last December. And we know that this has been just an incredibly challenging time for everybody. But we've learned a lot. And as we've learned more and gotten new information, we've made adjustments throughout this response. And that's what we do in medicine and in public health and in life, is make adjustments when we have new information. And so we're making an adjustment this week, as you heard, to the way that we make recommendations around quarantine. Now, the CDC does currently still recommend that individuals who have been in close contact should quarantine even if they're wearing face coverings. However, as you've heard, we've gotten some information from here in Iowa, as well as from some of our neighboring states, that help us to adjust our current recommendation while continuing to look at available information and data and move forward to make sure we're doing everything we can to keep people as healthy as possible. So as you've heard, public health has had a lot of conversations with school administrators and families about their experiences in quarantine and the fact that we don't frequently see additional infection in situations where people have been wearing face coverings. In addition to that, we were able to take a look at some of our own data from Sioux County, an area that's unfortunately experiencing increased community spread right now. And we were able to compare a district that was using face coverings to 3 districts that were not. And the 3 districts that did not make use of those face coverings actually saw 30 to 130% higher rates of new COVID cases. Now, in addition to that, as you've heard, our neighbors in Nebraska, as well as our colleagues in Wyoming, have made changes similarly in their school settings. And in addition to that, in July, the CDC's Morbidity and Mortality Weekly Report published a study out of our neighbors in Missouri looking at 139 adults who were exposed to 2 symptomatic confirmed COVID-positive hairdressers with 0 associated secondary cases. And the authors of that study concluded that broader use of face coverings can help mitigate the spread of this virus. So taking all of this information together, we're able to update our recommendation, which is going to say that for non-healthcare, non-residential settings, individuals who, when the case and close contact have been wearing a face covering consistently and correctly for the entire time, will not need to self-quarantine at home. However, we'll still want them to self-monitor, which means wearing your face covering and keeping a close eye on your symptoms. Now, this is exactly the kind of adjustment that we want to make as we move along based on best available evidence. And we're going to continue to work with our partners here in Iowa, with our neighboring states, and with our federal colleagues to gain more information and a better understanding. And if we find that there's new information where we need to make another adjustment, we'll do that as well, just as we always have all along. Public health and I remain committed to keeping Iowans informed and healthy. Thank you.